James Davies.
Thank you, Ms Elliott. I rise to speak briefly in support of the agenda raised by my honourable friend and member for Kingswood in his amendments 7 and 8, and the need to ensure that integrated care systems ensure that NHS organisations for which they are responsible conduct and also resource clinical research. Now, I think all would agree that the UK life sciences sector is world leading. I think that was evidenced during the pandemic by the way in which early PCR testing was brought forward for COVID, the recovery trial, the vaccine development, and so on. But existing activity is all too often limited in terms of its location in this country. We have world-renowned centres of excellence, often associated with teaching hospitals, and I would do nothing at all to weaken that. But the government's levelling up agenda needs to extend involvement in such activity across the country. At the same time, this can strengthen what Britain has to offer to patients and the world as a whole, and bring economic benefit to the country as well as to the NHS through increased income. Now, of course, I'm a general practitioner. As a clinician, I would argue that research adds interest to the role. It can improve job satisfaction, can reduce burnout. It's, of course, a form of continuing professional development, and it may make roles in more peripheral parts of the country or in less affluent parts of the country easier to recruit to if there is that research element. This amendment, doesn't relate to Wales, but I know that Glenclwyd Hospital in my constituency would really benefit from closer research links with the teaching hospitals in Liverpool and Manchester. And in terms of better patient outcomes, these of course can arise directly from involvement in trials, but also indirectly through a better functioning health system. And I would argue that research needs mandating, as otherwise it's all too often pushed to the back of the queue in a short-sighted attempt to maximise clinical output from staff. So I'd be grateful if the Minister would look at this area as the legislation proceeds. Thank you.